If you've ever tried to quit smoking or known someone who has, you know how incredibly tough it can be. But what if there was a proven roadmap, the one that health professionals actually use to help people succeed? Well, today, we're going to pull back the curtain on that exact system. And it all starts by challenging one very common idea. We hear it all the time, right? That all it really takes is enough grit, enough willpower to just stop. But honestly, the science, the clinical evidence, it tells a completely different story. It's so much more about having the right strategy than just having a strong will. And this is what that strategy looks like. I know it might seem a little complicated at first glance, but this is the clinical flowchart. It's the step-by-step guide that professionals follow. There's no guesswork here. It's a system that's been proven to work. So let's walk through this roadmap together, and I promise we'll make sense of it all. Okay, so let's start with the absolute bedrock of this whole approach. It's all about understanding that the very best strategies go way, way beyond just deciding you're going to quit all on your own.
Here's the key, right here. It's a powerful combination. The guidelines are crystal clear. Your chances of success just skyrocket when you attack both things at once: the psychological habits through counseling and the physical addiction through medication. One without the other just isn't nearly as effective. This two-pronged approach is really the engine that drives the whole process.
So how does this journey actually get started? Let's imagine you're walking into a clinic or a pharmacy for the first time. What's the very first thing that happens?
Before anything else, it's just a simple private chat. The professional just wants to make sure this is the right service for you, and they get your okay to move forward. It's all about making sure you're in the right place to get the absolute best support.
Next up, they're going to build a picture of your overall health, and they get pretty detailed here. They'll ask about your age, any medical conditions you have, medications you're on. All of this is to make sure that whatever quit plan you build together is totally safe and won't mess with anything else going on with your health. Then, they dive into your personal history with smoking. You know, how soon you have that first cigarette in the morning? That's actually a huge clue about your level of nicotine dependence. And when they ask about previous quit attempts, it's not about making you feel bad. That's gold. It helps them learn what worked, what didn't, and how to make this time different.
So, you might be thinking, wow, that's a lot of questions. And you're right, but there's a really good reason for it. All of this info lets the health professional create a quit plan that is tailor-made for your body, your habits, and your life. This is where it stops being generic advice and starts being about you.
And it's not all just talking. There's a quick physical check too, usually just a simple blood pressure reading. It's a fast way to screen for things like high blood pressure that could be important for your quit plan. It's just another layer of safety.
Okay, so all that critical information has been gathered. Now comes the exciting part: actually building your personalized strategy to quit smoking for good.
And this is so important. There is no cookie-cutter, one-size-fits-all plan here. It's all about you. Are you ready to set a quit date right now, or do you need to cut down first? What are your biggest fears or challenges? The plan is built with you for your actual reality. All right, now let's talk about the tools that go into your personalized plan. You can think of this as your quitting toolkit. So your toolkit is basically split into two main sections. On one side, you have behavioral support. This is all about the psychological stuff, rewiring your habits and figuring out how to handle your triggers. Then on the other side, you've got medication-based support, which tackles the physical battle, helping you manage those intense cravings and withdrawal symptoms. So let's look a little closer at that behavioral side. This is the practical rubber-meets-the-road stuff. Like, what are you going to do during your morning coffee break? How will you deal with stress without reaching for a cigarette? It involves creating real-world strategies, figuring out who in your life can be your cheerleader, and connecting you to amazing services like Quitline for round-the-clock help. And for the medication part of the toolkit, there are a few really effective options. You've probably heard of nicotine replacement therapy, that's NRT, you know, the patches, gum, lozenges, but there are also prescription meds like bupropion and varenicline. The right one for you? Well, that all depends on that de-sealed history we talked about earlier. Now, safety is a massive deal here, so this system has some critical checks built right in. For example, if you're pregnant or taking a medication that could have a bad interaction, everything pauses. You'll be immediately referred to a doctor or a specialist to make sure your safety is always the #1 priority. But what if your situation is more complex, but not an immediate red flag? Well, this is where the team approach really shines. A pharmacist can get you started on a plan, but they'll also loop in your doctor or specialist. This makes sure your chronic condition is being managed right alongside your quit attempt. It's truly collaborative healthcare.
Getting the plan is one thing, but as anyone who's ever tried to quit knows, the real challenge is sticking with it, right? This is where long-term support becomes absolutely essential.
See, the support doesn't just stop after that first visit. You're not just handed a plan and sent on your way. You'll get super clear instructions, and then you'll have regular check-ins. That first follow-up is often just 2 weeks later, just to see how you're doing, talk about any side effects, and make tweaks to the plan. It evolves as you go.
Now, this next slide has a direct quote from the clinical guidelines, and I really want you to hear this. It says that most people go through multiple quit attempts and relapses before they finally quit for good. The professionals know this, they expect it, and it's so important for you to know that this is a totally normal part of the process.
And this really gets to the heart of it. A relapse is not a failure. It's not a dead end. Think of it like a data point. It's just a sign that you need to reconnect with your support team, figure out what happened, and adjust the plan. It's not about starting over from scratch. It's about learning and moving forward. So, after seeing this whole professional roadmap laid out, from that first conversation all the way to long-term support, it's pretty clear that quitting isn't a single event. It's a journey, and it really leaves you with a question to think about. If this is the map, what would taking that very first step look like for you, or maybe for someone you care about?